and welcome to Make America Healthy Again. Join Dr. Charles Antinori and friends as they share solutions, tips, and insights that only doctors know for creating better health. Here's Dr. Antinori.
This is the Make America Healthy Again podcast. I'm Dr. Charles Antinori, and today my guest is a little different than the other ones we've done. Is my ex-wife and good friend, Christine Rothwell. And this is going to be a little bit of a different podcast because all the other ones we discussed various types of surgery, like robotic surgery, laparoscopic surgery, what's happening in healthcare, the healthcare costs, etc. But today we're going to talk about what it's like when a real healthcare catastrophe hits very close to home. So Chris's sister Leslie is here too. She's going to be chiming in occasionally. She's been through Chris with this whole process, which is amazing amount of work. The driving and everything, care is just, it's unbelievable. And again, even as a guy that's practiced for 50 years, and taking care of family members who had cancer, but I've never seen it really this close up before, and never such a surprise before, you know. So I'll let Chris tell her story from, how this evolved. It's only really been a couple months, the whole thing. But
well, it really started in October, where I felt like I can't even describe, like a fullness would be the best word to describe it in my pelvic area, and I was urinating at night more than I ever did. Right. So I thought it.
Remember, you asked me to give you a script for a urinary tract infection. You were going somewhere and you thought you had a urinary tract infection, but you had a meeting or something.
No, we went to Texas.
Yeah.
So I thought for sure it was a UTI, and that didn't seem to clear it up.
Right.
So I went back to the doctors, and again was prescribed that medicine because that's exactly how it felt. It started with frequent urination.
Well, it could be just tumor pushing on the bladder, exactly. Making your bladder smaller, so you frequently urinate. Yeah,
And I started getting like a pain, but not the UTI kind of pain. It was more like sometimes it was a sharp pain, and sometimes it was like a dull, persistent pain. So I knew it was not a UTI, so we stopped the meds for that.
Yeah. Let me just interject that you're one of the healthiest people I've known. You never smoked, always kept yourself in great shape, athlete, in high school.
But I do have a family history of cancer.
Right.
My mother had bilateral mastectomy.
I did them.
Yeah. And my father had
lung cancer, which was unresectable by the time we found it. He did smoke, unfortunately, though. Yeah. And your mother had so many other things too. The polycystic liver and kidneys, and so she went into renal failure eventually.
Right. Exactly.
Yeah.
But I was somewhat, otherwise I was healthy, go to the doctor regularly, had blood work done every year. I went to the gynecologist like a few months prior to that. Everything was okay. And then the pain became more and more intense. And then by December 3rd, I just couldn't take it anymore. So instead of going to work that morning, I drove myself to the ER. And I was dressed for work, so I was dressed up and went into the ER, and the pain was just getting to the point where it was almost unbearable. I was like doubled over, sitting in a chair. And they called me back, and a nurse came into the room and asked me questions, and I guess, I don't know, the doctor may have come in. If he did, it was later on. They did the normal, start an IV, gave me Compazine because I told them I was getting nauseous from the pain, but I hadn't vomited at all. They ordered a CAT scan and an ultrasound for me.
And blood work too.
And, they did blood work.
Right.
And I went down the CAT scan. Now this is before the doctor even saw me.
Really?
Yep.
Wow.
Yep. Well, no one came into the room. Yeah. Let's put it that way. I was in pain, so they gave me something for the pain. And I did they did the CAT scan, then they did an ultrasound, and they did a transvaginal ultrasound as well. And I could pinpoint with my finger exactly where the pain was.
Yeah,
and
let me interject here that I had examined you around this time. I can't remember exactly what day, but you were definitely tender in that one spot, kind of in the left lower quadrant, just above the pubic bone, just a little to the left of the midline. Yeah. And not bad tenderness, but definite tenderness. There was no question. Yeah.
I told them exactly where the pain was. Even the ultrasound techs, I told them, and they actually touched that spot with the transducer and made me jump. That's how much it hurt. And they took all their pictures, and I went back to the room, and then the doctor came in and said, nothing showed up on the CAT scan or ultrasound, so we're going to have to let you go.
Yeah.
And that was December 3rd. Yeah. So I was a little. The
blood work, as I remember, was essentially normal. Maybe a little anemia or something like that. But other than that, it was anemia, low red count, low blood. But otherwise, that was all normal too. Yeah. And like you were saying, as far as we were talking about the physical exam, this is what's happening. The guys, the CAT scans have sort of, in many ways replaced the physical exam. This exam, not only CAT scans, but the MRIs and all the other things we do. A lot of physicians, they're busy. First of all, the ER doctors are busy. That's one problem too. And, I think they think like, well, I should already had a CAT scan. Like, what am I going to find? If the CAT scan didn't show something, what am I going to find poking around? But
never touched me. He leaned against. A matter of fact, he was leaning against the wall. He wasn't even coming close to me. Yeah, I'm
really shocked that the ultrasound, especially the transvaginal ultrasound, didn't show something. And like you said, you thought that nurses were a little concerned, but then the reading, which is all we ever saw.
Yeah, the text. I was in there for
the text. Yeah,
I was in there for a while having the ultrasound done, and when especially when I hit that spot, I said, "That's exactly whatever you touch. That's
where it is.
These spots." Yeah. And it seemed to me that she called in another tech. Yeah. So like a more.
Usually, you would think that means that something's weird's going on. Yeah.
Something.
Yeah.
And they told me they found nothing. Yeah. And then without a physical exam, they let me leave. Yeah. Yeah. And it's very frustrating because the pain was still persistent.
Yeah, and I have to say again, I remember telling you that, like, well, here's the good, and this is what I told patients for 50-something years. Like, when you get a normal CAT scan, there's lots of times, even before we had CAT scans, we used to do barium enemas and GI series and things like that on people, and I would tell them, look, we didn't find anything, but at least, I know you have some pain, but we can't find it. At least it's probably nothing really terrible. So I think I told you that. It's probably nothing, because you kind of assume the CAT scan is going to find something really bad.
And I don't know if you remember back when you did my appendix. Yeah. The reading was exactly the same.
It was normal. Yeah.
It was normal.
Yeah.
Was that a CAT scan as well?
Yeah, CAT scan or ultrasound CAT scan.
It was a CAT scan.
I remember the first couple of times they said you had appendicitis, and I thought for sure you didn't, and we postponed you. You didn't have appendix the first one or two times we saw you, and then the time they said you didn't have appendicitis, you did have appendicitis. Yep.
And it had ruptured. And if you didn't go in and do, I refused to have anybody else come in because you were working there at the time. Yeah. If you didn't take me to surgery, I had a ruptured appendix for 3 days. Yeah.
Anyway, but this goes, I guess the moral of the story is CAT scans do not just show everything, especially was done with, and then most CAT scans are done without oral contrast. Mm-hmm. Most are done with either no contrast at all or just IV contrast.
Yeah, they did IV contrast.
Yeah, most of the time, the only time they don't want to give IV contrast is if you're worried about a kidney stone or something like that. They usually don't do any IV contrast either.
And in hindsight, to advocate for yourself now. Like, now when something isn't right and doesn't feel right. Keep as much as a pain you can be. Be persistent.
And I did tell you, I did give you one advice that what you have to do next was see a GI guy and see your gynecologist. But all of this transpired before you could even get those appointments made. Not to mention it was around Christmas time.
So skip forward a few weeks. That was December 3rd. Skip forward until Christmas Eve. Right. and I wasn't feeling well at dinner. I actually left early, Leslie's house.
Yeah.
I went home and I got changed and I went right to bed. It was somewhat early. And I woke up with pain again. This time, a little bit worse than the last time. And I got my son Cole to drive me to the hospital. And went into the ER. And I think they took me a little bit more serious this time because here I am in my pajamas.
Yeah.
And it's Christmas Eve.
Yeah.
And I had so much pain that they ordered the same tests that I had last time.
Right.
The CAT scan, the ultrasound. Did
they do an ultrasound again?
Yep.
Wow, I remember that. Yeah.
They did put an NG tube in me.
Right. Which was in for like 6 days.
Because
7 days.
I think it was 7 or 8.
7 or 8, yeah.
And I did throw up before I went to the hospital because of the pain.
Yeah.
And so they put the NG tube in, and they did a consult with a surgeon.
Right.
Thank goodness they did.
Yeah. And that CAT scan did show the thickening of the terminal ileum, which
I don't know if that one did. I think that one was normal as well. It was the third one.
But that one, that's why they left the NG tube in, because of the thickening of the terminal ileum. They thought you were obstructed. That's why they had the NG tube in, because they thought you were obstructed. And you were. You were obstructed.
Yeah.
Even though you really, again, the obstruction, the terminal ileum is the small bowel, like right before it goes into the colon. And for people listening, the small bowel is like 20 feet long. So like before you start vomiting from an obstruction like that, if it's way down far like that, it takes a long time for the whole thing. The whole thing basically has to back up through your entire 20 feet of small bowel before it gets to your stomach, and then you vomit. But that's why, and again, the fact that it was Christmas Eve definitely played into this. And the fact that Christmas was a Thursday this year. So, nothing got done Christmas Day, nothing got done on that Friday, nothing got done on the Saturday, and not nothing got done, but they would check you, they would NG tube, IVs. But really was the Monday they did the scope, and they couldn't get in. They only got about 10 centimeters or 15 centimeters or something like that. And then he had trouble scheduling you for surgery, because it wasn't until New Year's Eve that you finally got to the OR.
Right.
And remember, then the day before, they did a third CAT scan. They did a third CAT scan.
CAT scan is where...
Right. They read it, and that was the one, that's the one they read as, peritoneal metastases. Again, for people listening, that means cancer droplets that have gotten, as it turns out, this is ovarian cancer. It turns out to be stage 3. And the fact that you have peritoneal droplets, what happens is the ovarian cancer cells come out of the ovary, probably go through the tube, and then or come out of the tube, somehow just spill into the peritoneal cavity and start growing on whatever they attach to, your organs and things like that. Yeah. And that third CAT scan, by then, this time you were really pretty sick. You had me read the CAT scans. You remember you were forwarding me the
results. The test results.
Yeah, portal, the stuff from the portal. And so I'm reading it, and I read about the peritoneal metastases, and I wasn't going to tell you about it because I figured it was bullshit, because I had 2 CAT scans that didn't say that, and I'm wondering, how's this third guy reading this? And I even gave the hospitalists that came in a little bit of a hard time, about this. I think that's why the hospitalists came in, because the surgeon was up at Cooper, 90 miles away, and really couldn't come in himself to talk to you about it. So I think that's why they sent the poor hospitalists in to talk about it. And I told them, I said, how can it be that there's peritoneal metastases, and the first 2 CAT scans, one just done a week earlier, the other one done 3 weeks earlier, didn't show any of this.
It was a different radiologist that read
right.
it.
Well, that's it. And
it was the third. The first 2 times was the different, the same one.
Yeah.
And then the third one was a different radiologist.
Yeah.
So do you think they were there on the first 2?
Well, like I said, we
just not.
As I said, we reviewed them. After all this, I eventually got them on a disc. We got all the films on a disc, and I took them to Elmer Hospital where I was working at the time, and it took them like a day to get them entered into their system so we could look at them. But I did look at them with one of the radiologists up there, and he retrospectively, he could see the nodules you was talking about in that left lower quadrant area and everything. But he also said that if he had to read that CAT scan, de novo without any other information, by then we knew that we had ovarian cancer. But if he had to read it without that, he would have probably not been able to call it that either on those first couple of CAT scans. So that was it. And then, like I said,
the surgery was on what?
New Year's Eve, right?
Mm-hmm. Yeah.
The day after your grandson got born.
Yeah.
He was New Year's Eve. Yeah. And
the surgery determined that
they biopsied, you had peritoneal implants.
Yeah.
They took out some of your omentum and had some implants in the omentum, which is a fatty sheath that's inside the abdomen, and ovarian cancer tends to go there.
And then with the ileostomy,
and then because of the obstruction of the terminal ileum, which was not due to, we were talking about Crohn's disease and things like that, which didn't really make sense because you never had any symptoms of Crohn's,
right?
But or some kind of bowel syndrome, that we had been talking about that, but it turned out that the obstruction of your ileum was from tumor laying on it and kinking it or whatever. I didn't see it, so I don't know exactly, but talking to your surgeon, he felt that the obstruction of the ileum was related to the cancer. And so that's why he had to do the ileostomy, which turned out to be the biggest problem. One of the biggest problems in this whole recovery. Yeah.
Not fun, but necessary.
Yeah, but like I said, in this case, there was no way around it. He had to do it. But anyway, so jumping ahead, like you've had the three rounds of chemo so far. Yeah.
Three.
Yeah. Each of which takes 4 or 5 hours. Not to mention about almost a 2-hour drive to get to the hospital where we're doing it. And the first one, we went, and it was like right after a huge snowstorm.
Worrying about how we're going to get there.
But luckily, the good news is that the tumor grew very fast, and so far it seems to have really responded tremendously, or rapidly to the chemotherapy that you've gotten. And we're going in 3 days to talk to the gynecologic oncologist surgeon and decide about doing next stage, which is the surgery, removing the uterus, the ovaries, any cancer that they see, and hopefully closing the ileostomy maybe at the same time. And then after that, still 3 more rounds of chemotherapy. So that's three more. And the chemo's been 3 weekly, right? Every third week. Every third week. Yeah. And not to mention the blood tests in between and the
blood tests, right before,
and CAT scans. And then we've had, how many times you've probably gone to the hospital? You just got admitted a week or two ago for dehydration, but you've gone for elective hydration like 3 or 4 times.
More than that.
Yeah, just where we went in once a week for a while.
I went twice last week.
Yeah.
That Monday
just to get
Thursday
just to get IV fluids, and that's again got a lot to do with the ileostomy. It's very hard to hold, to eat anything and more comes out than you can take in. Especially after you got the flu from the little girls.
Yeah, that was bad.
Got a little GI flu from our granddaughters.
When I was in the hospital the first time with the NG tube, when you have an NG tube, you can't eat or drink.
Yeah.
So I lost a lot of weight after 8 days of not eating and drinking. I lost, oh my gosh.
You were 100, when we went to the oncologist the first time, you were 115 pounds. And your baseline was probably like...
116.
You're 116, okay.
But I was like 135.
When this all started, which is when weight you look good at, like 135 is a real nice weight for you, Yeah, but so you lost like those 20 pounds along the way there. A lot of
very quickly.
Very quickly. I mean, some of it was probably from the cancer, but a lot of it is from the dehydration too, from the ileostomy. But so things are, like I say, they're kind of looking up now. The other thing to talk about for people listening is the testing. there is a blood test that specifically for ovarian cancer, and we're talking about why it doesn't get done more. I don't know. I've asked. It's not terribly expensive apparently, but it's called CA-125, and as initially it was sky high, and then it's been going down, nearly down to normal with the chemotherapy. And CAT scans are improving with the chemotherapy, so everything's going in the right direction. But
there's one more thing to mention too is the
CA-120, the BrCa, right?
The genetic testing. I was sent. My GP ordered the genetic testing, the BrCa test,
a while ago, right? This is
a while ago,
right?
And
how a year, 2 years?
I think it was 2 years ago.
Okay, largely because your mother had the 2 breast cancers, right?
Yes.
Yeah.
And I didn't realize at the time, because I didn't go through the geneticist. I just called the lab to get it done, or it was prescribed.
Yeah.
And the lab called me and started asking me a lot of questions, like family history questions. But they called in the middle of the day. I was working. Right. I was unprepared to answer the questions. Yeah. I didn't know a lot of the answers. I couldn't remember exactly what
dates,
how old my mother was when she had cancer. Well, apparently it was very important that I answer them correctly, which they didn't tell me this. But it determined whether or not the insurance would cover the test. The testing.
Right.
And it turns out, like I guessed at how old my mother was. I said 50 the first time. Well, 49 was the cutoff for me getting
getting the insurance
to cover it. And
at the time you weren't that worried.
No, but it was like a couple grand to get the test done.
Oh, wow, really? Yeah. Oh, wow. Yeah.
And I
think they've come down too, but still, it's still expensive.
I'm not going to pay extra, and just forgot about it.
Yeah.
And that test would have shown that I am, because
now we've done it, right?
I did go through I went through a geneticist, which I recommend that if you're thinking about getting the BrCa test done, you talk to a geneticist, and they will advocate for you if the insurance does not pay.
Right.
And they have different avenues of having the lab get funding for you. And I think the most she said I would have to pay is like $200.
Yep.
Yeah.
That's a big difference.
Yeah, right. Yeah. Oh yeah.
I would have had the test done.
Especially for something sort of prophylactic at the time. You're not really sick. But
I would have had the test done if it was a couple $100 as opposed to $1,000.
Right.
And it turns out I am BrCa positive. Yeah. BrCa 1.
Which
positive.
Not BrCa 2, just one.
Just BrCa 1. And now my sister has to get the test.
Right.
My daughter has to get the test. Our daughter.
Yeah.
And it's very important. And like I said.
And again, just for people listening, the BrCa gene is not only for breast cancer, but it's also ovarian cancer runs with breast cancer, which is something I knew and just don't think about that much, because it's not the gynecologists take care of it. I don't really. And
prostate cancer.
Right. Yeah.
So men can get breast cancer too.
Right.
So like our sons can get the test done.
Yeah.
They think it's necessary.
Yeah.
But it's very important, I think, to talk to a geneticist first.
Right.
And have guidance on everything, and have her explain the importance of the test, and advocate for you.
Right.
And it worked out well. My insurance ended up covering it, obviously. But
it's going to be interesting to see what sort of bill you end up with at the end of all of this, because I can tell you,
I've been paying as I go.
Yeah. Has it been? I don't. We talking hundreds, thousands, or what?
No, nothing's been over 1,000. But I do pay $1,649 a month for health insurance.
That is getting to be about average. I've been reading. For a health person, that's getting to be about average.
But it has been worth it.
Right. Oh yeah.
Paying
for
this.
Yeah.
And the insurance company actually has a caseworker who calls me on a weekly basis to ask me if there's anything I need, or if anything needs. I had trouble getting anything approved.
That's what I say. We got a great healthcare system. It really is,
it's expensive.
It's just expensive, and then like you say, when the insurance company, you try to be logical, like you say, the people asking you, how old was your mother when she had breast cancer? You know what I mean? Like,
but it wasn't
what was the lab? I mean, because the lab won't get it paid.
I didn't know how important that was.
But I mean, I say that's the problem with everything too. Is like every time you try to save a little money, try to be cost effective, somebody always slips through the cracks because of that. I mean, there's always going to be, when you say cost effective, you're kind of saying like you almost mean you're going to let a few are going to slip through, but you just can't do everything on everybody all the time, because it's just too expensive. A big one with this was the lung cancer CAT scan thing. This was probably 10 years ago now that they decided to let you just get screening CAT scans. Because I can tell you, as a guy that did chest surgery for 50 years, what you pick up on a chest X-ray is a fraction of what you pick up on a CAT scan. And again, as we've talked about here, you can miss things on a CAT scan, but you can really miss a lot more on a chest X-ray. By the time something shows up on a chest X-ray, especially a lung cancer, it's often too late.
Yeah.
Well, how was Daddy diagnosed?
Pre-admittance testing for, I don't even know what he was getting done.
Yeah, I forget, it was something else done,
he started, he went through the hospital's program to quit smoking.
Yeah.
So they did a chest X-ray, a baseline chest X-ray, a year before, and it was normal.
Well, see, I remember that, right? Yeah. And again, that one of the reasons chest X-rays can be normal is his tumor, if I remember, was in the left hilum.
I think it was right in the center.
Right in the center, and the heart hides it. Yeah. Especially if you're just doing a PA chest, the front. Yeah. Sometimes the lateral will pick it up, but even there, it can get buried because the hilum of the lung, which is where a lot of the lung cancer start, is kind of right behind the heart. And so the heart basically, covers it, so you don't that's why that's one of the reasons I'm saying the CAT scan picks up a lot more. But anyway, again, to get back to what I was saying is that so they decided that you could have criteria that people can get along to, and the criteria, we had to be a certain age. I think it was like 50 to 70 years old. You had to have had a 20-pack year smoking history or something. So and then you were allowed to get a screening CAT scan. And it didn't prove to be very cost effective, but it did pick up quite a few cancers. And now I believe you can still they've modified it a little. I think they've actually made it a little bit easier to get it. But again,
the geneticist told me that the age range too that I was declined for has changed.
Yeah,
I think she said that. She didn't say what it was, but she said back then it was the 50. Range was 50 and under. 49 and
below
or less.
Yes, right.
Below 50.
Early breast cancers.
And I think she said she's that was changed.
Yeah, just saying the colonoscopy, they found a lot of younger men. They've lowered the stage of your first screening colonoscopy. I think to 40 or 45, something like that.
45
yeah, 40 or 45 now rather than 50, because they're finding especially men are having cancers. But again, but I guess we're to summarize it. We're on a half an hour here. It really has been a very interesting thing for me. I've learned a lot, and hopefully it looks like we're going to have a good.
And thank goodness outcome. We have you through all of this. You have been a saint through all of this.
And you too, Nestle. You put in a lot more time. You put in a lot more time than me.
It's good to have. I'm lucky that I have you as an advocate as well. But I can't imagine going through this without having some type of person to advocate for you.
Yeah, I've told you about that friend of mine. I don't want to mention his name, but keeps calling me up with his bladder problem. Oh my God! And he's got so many other things. And he's, like I say, a very smart guy. But an attorney, and he has no medical background. I mean, that's the thing. You've had a medical background at least,
And it's scary.
So,
I can't imagine for someone.
But if you're a smart guy with no medical background, it's hard to figure. I know when going through the divorces, somebody with a no legal background, it was pretty scary, and you're really pretty dependent on your lawyer to get you through the legal hurdles, and malpractice cases too. You're kind of depending on your lawyer to tell you how to play this. And so I guess it works both ways.
Right.
Anyway, I guess that's about all for today, and we're just hoping that this kind of continues to get better, and And by the end of the summer, it's all taken care of, all behind us.
Yep.
Thanks, Charlie. Thank you, Charlie.
Great. Thanks, guys.